Hi there, my name is Adeola Mbaneme. This presentation will be on childhood trauma and bipolar disorder. According to the APA, trauma is an emotional response to a terrible event like an accident, rape, or natural disaster. Immediately after the event, shock and denial are typical. Longer-term reactions include unpredictable emotions, flashbacks, strained relationships, and even physical symptoms like headaches or nausea. While these feelings are normal, some people have difficulty moving on with their lives. Children who experience trauma, depending on the severity of it, could be at risk of a lifetime worth of detrimental repercussions, especially as it relates to their mental health. We learn that as an infant in Howe's book, Child Abuse and Neglect, he discusses the idea of attachment in early childhood and how it's actually a function to protect the young from danger. When an infant feels safe, they are free to explore and investigate. However, for abused children, when a child is fearful, and abused children will be fearful, this actually hinders their emotional and cognitive development and is severely compromised. They actually are rather anxious and impulsive. So rather than to see the environment around them as exciting, abused children are worried about survival and consumed with the need to feel safe. We know that children who experience complex trauma feel betrayed, and these feelings of betrayal cause a child to have negative thoughts about themselves. Feelings of betrayal from a caretaker-induced trauma also destabilizes a child's healthy environment. We also know that those who experience complex trauma in childhood are at high risk of re-traumatization across their lifespan. And this is because once a child is in survival mode, a trauma survivor will adopt the identity of a victim, and this notion will continue to leave an imprint on that individual's psychological and personal development. And really, survival can become how one defines themselves and their ability to relate to others. Many childhood survivors of trauma, particularly as it relates to relational trauma, often struggle with feelings of low self-esteem, and they can be prisoners in their own emotions. Given all of the significant consequences of childhood trauma to the psyche, it is really no surprise that the growing number of research studies have linked childhood trauma experiences to bipolar disorder. So what is bipolar disorder? Well, the APA defines bipolar disorder as a serious mental illness in which common emotions become intensely and often unpredictably magnified. Individuals with bipolar disorder can quickly swing from extremes of happiness, energy, and clarity to sadness, fatigue, and confusion. These shifts can be so devastating that individuals may choose suicide. All people with bipolar disorder have manic episodes, abnormally elevated or irritable moods that last at least a week and impair functioning, but not all of these individuals become depressed. So we know about 5.7 million adults in the United States are diagnosed with bipolar disorder. And that is also estimated to be about 4.4% of adults in the United States. The level of severity of the impairment can range from moderate to serious, and research shows that in the past year, 2.8% of adults were living with bipolar disorder in the U.S. Based on the Sheehan Disability Scale, about 82% of that 2.8 of adults living with bipolar disorder are on the severely impaired spectrum, while 17.1% are moderately impaired. Bipolar disorder can also affect adolescents, and a diagnostic interview data from the National Comorbidity Survey adolescent supplement show that 2.9 of adolescents ages 13 to 18 suffer from bipolar disorder, and 2.6% have serious impairment. The prevalence for bipolar disorder among adolescents appear to be higher in females, showing that it's 3.3%, than for males at 2.6%. Although adolescent bipolar disorder can be linked to childhood trauma, this paper will still focus on the concerns as it relates to childhood trauma and its relationship with the onset of adult bipolar disorder. We know that childhood trauma has a positive correlation with the inception or onset of bipolar disorder. In a study conducted in Spain on childhood trauma on cognitive profile and bipolar disorder, 113 adults living with bipolar disorder were analyzed. They were broken up into 3 groups based on their cognitive functioning: high performing, average performing, and low performing. Their socio-economic and education levels were taken into consideration to scale the results of the IQ test, which was used to place these individuals in these corresponding groups. The participants were also given a childhood trauma questionnaire, CTQ. The study showed that most individuals in the lower performing group also had a high score of the child trauma in the CTQ. In regards to the functional outcome, in general terms, patients belonging to the lower performing and average performing groups showed not only poorer overall functioning, but also more functional impairment in several functional subdomains, such as autonomy, interpersonal relationships, and leisure time. And concerning financial issues, the lower performing patients presented higher impairment scores compared to both the average performing and the higher performing groups. In this research paper, the discussion identifies a higher risk of severe impairment for individuals with bipolar disorder and a lower IQ who suffer from childhood trauma. In addition, the research found a significant correlation in the CTQ physical neglect subscale and poorer performance in tasks that assess attention, working memory, verbal learning, and memory. Adversely, the research called out that having a higher IQ may actually help to lessen the risk of severe impairment and act as a defense for those who survived childhood trauma. Individuals who were grouped into the high performance category tended to have better outcomes overall over their average and low performing counterparts. So as we can see here, childhood trauma significantly and negatively affects individuals with adult bipolar disorder. The severity of the disorder has proven higher in those who have experienced a significant amount of trauma, and especially trauma as it relates to physical neglect. Because of the severe risk factors surrounding childhood trauma and bipolar disorder, it is important to bridge the gap between medical professionals and mental health care professionals, and for each to understand their role in the treatment of bipolar disorder and the prevention of childhood trauma. According to the APA, many healthcare professionals think that bipolar disorder is an illness that can solely be treated by prescription medication. In contrast, the past decades research informs us that psychosocial therapy is an effective treatment for the disease when combined with medication. And it's very important for each healthcare professional to work with a team that includes each level of clinicians to work together to ensure the patient is treated as a whole. Unfortunately, there are some barriers to treatment, especially for those who may be newly migrated into the country, or someone who might not speak the same language as a clinician, or someone who is in a disenfranchised community. Some of the barriers may include a lack of access and awareness, as well as a burdensome amount of documentation to complete that might be too overwhelming for the patient, and possibly the need to use a computer for registration, where one may be computer illiterate, the inability to communicate with a provider in a patient's native language, as I just mentioned, or fear of being judged or reported for those who may be undocumented. Also, a fear of loved ones being outed or arrested, especially if the caretaker in question is the primary caretaker. There can also be a lot of logistical issues, just like distance or work schedule, that could prevent an individual to seek treatment. In our Gill book, she suggests that making services more user-friendly and accessible is a major concern that should be addressed daily in the mental health field. And I quote, "It seems essential to listen well to the experiences of our clients if we are to be of true assistance." The APA calls out research that proves 3 effective varieties of psychosocial treatments of bipolar disorder, and those are cognitive behavioral therapy, and more specifically, I conclude that trauma-focused cognitive behavioral therapy may be particularly useful for adolescents, family-focused therapy, and interpersonal and social rhythm-based therapy. And that concludes my presentation. Thank you so much for listening, and have a good day.